And I found this lovely thing on the website that to me summarizes everything. So CAE is a retrovirus similar to the HIVs, right? It can be transmitted in all secretions, okay? And the symptoms are swollen knees, what they call the hard udder. The udder gets very hard and swollen. So it's more of a problem with milking goats, okay? It can decrease your lifespan, and also you have a neurological form, which is paralysis, causes paralysis, normally hind limb paralysis, and then death, okay? And there is no treatment. And the only prevention is? Yeah. Okay? So if you have it, you have to make a decision as to what you want to do. Now again, laws will prevail. If you're in a country that is CAE free, you don't make that decision. The government will make that decision for you, which will be to get rid of everything that you have here. Anybody again who has also bought animals from the US, unless you specifically tested for it, I don't know if you have it or not. That's all I'm going to say to you. So be careful. So you would see things like this, swollen knees from a CAE positive goat, a hard udder, they get very bad mastitis, right? And it's a very difficult disease. It's a virus, so you can't treat it. Very difficult to control from the standpoint of once it's in your herd and the mother has a baby and she nurses the baby is going to get it. So you can, the only way to control, I've worked with some herds in the US too, they do a good job of eventually eradicating it, especially they do milking animals. It's not zoonotic, so that's a great part, so it doesn't bother about the milk. What they do is, as the animal's kid or lamb, they take them away, they take them away immediately and will bottle feed, right? And eventually over time, you'll cull out the ones that are positive and your herd will can remain free, but it takes 4 to 5 years. And then of course the CAE positive, I've never seen clinical evidence of it. I've only worked with herds that have had it, but never seen an animal sick, so I didn't have any pictures. Pregnancy toxemia is a condition, especially people who are from, if anybody's from Barbados here, yeah. Right? So when you have the multiple fetuses, or if you have in a situation where you have high producing goats or high producing sheep with multiples, twins and triplets, again the local goats, but somehow the local goats don't seem to come down with it as a problem, you know, because I think they're very, again, more hardy, right? Yes, because of energy, right. And I was in Barbados at Green Island, and what they do, and I'm not saying you must do that, I saw what they did, they actually give ad-lib molasses to mothers in the last month. They just put an open barrel with molasses and they can eat it, okay? And drenched with glucose, that's right. But you want to prevent it. You don't want it to happen. It's also called ketosis. It happens in the last 6 weeks of gestation and multiple fetuses. That's the criteria you need. And why I bring it up, again, I don't see that often, but when we do see it, and again, we're trying to push more for production. We're hoping people are selecting animals for more multiple births. So that's why I brought it up, because it's going to occur when you start having that multiple birth situation. It's primary, where basically the animal can be undernutrition or starved, or it has access to low quality nutrition. Or secondary, where something, disease affects it consuming enough food, right? And then again with overnutrition now, that's the caveat, where basically when they're too fat, now how that one works is that when they're so fat, their stomach can only eat so much anyway, but because they're fat, they need more nutrition than a regular slim animal, so that their calories don't match what they're eating, okay? So abnormal behavior, they're unable to rise, they show what they call stargazing, where you look at the animal just basically is looking up in the air. They're unresponsive, they eventually will die, right? And they stop eating, teeth grinding, all of those things, okay? So, and they will die unless you do something, right? And something is normally you make a choice you make a choice to save the mother. So you will do a C-section, normally because she can't push it out. You do a C-section and you pull out the babies in the hope of saving the mother, all right? So other options, you can treat, as Maki said, you can give your glucose or propylene glycol, B vitamins, fluids, dexamethasone, and C-section. That's really your options, okay? Prevention, you monitor your body condition scoring. I'm sure they went through that with you all, so I don't need to go over that. Reduce your stressful situations and anything that can cause stress. And then again, I am a big advocate of this, especially my high-producing mothers. I give grain at the last 6 weeks, or anywhere from 2 months onward. In the last 2 months of pregnancy, I give them grain, right? I give them up 1 pound going up into 2 pounds, right? Because I don't want to lose the mothers, and I certainly don't want to lose the kids or lambs either, okay? This is the last part. We want to talk, because prevention is really what I believe in more than, like I say, I don't go around sticking animals. I don't have time for that one. I prefer in prevention. And I believe if we don't have good lamb care, we really don't have anything to speak about. Because you need to ensure that your lamb has adequate colostrum. The lambs are kept close, or kids are kept close to their mother. You need to dip your navel in 1% iodine, and I'll tell you why in a second. I actually using the 7% iodine now. It does burn a little more, but I find the navel dries up a little faster, right? And we have had some problems with screw here, and when I use the 1%, I find that if we're not vigilant, within a day or two, the screw worms pitch on it. But with the 7% iodine, it also sticks better to the navel. So I've been using up to the 7% iodine, not the 10%, 7%. Tail docking, if you wish, try and do it as early as possible, all right? And castrate as early as possible also. So I'm a big believer in these kidding or lambing pens, right? You don't have to necessarily make a fancy pen. What you can do, is you get pallets, and you use some pallets and make a square pen for them. It helps the mother bond with the baby, right? Especially first-time mummies, and it makes a big difference. Also, it creates an environment for frequent feeding for the first 2 to 3 days. You see, especially these goats, they love to wander off. And then the poor kid can't even keep up with them, so they don't feed as often as they should. So I keep in my mums normally for the first 3 to 4 days, and make sure that that bond is there, make sure that they're nursing frequently and quickly, okay? And again, you don't have to build a fancy pen. You can make one with some pallets. Just put up a square pallet and put the mummy in there, but make sure she has feed and water, okay? Colostrum management, you need that if your doe dies or is too sick or malnourished. You need about, and farmers ask me this all the time, how much colostrum? So I just milk, you need to get a minimum of 50 mils per kilogram. So most kids or most lambs are at least 2 kilograms, so they need to get, 100 to 200 mils, all right, 4 times a day. And the old rule again was, you need to give colostrum within the first, 24. That's not it anymore. It's actually within the first 12 hours. The faster you get them colostrum, the better the response is, okay? Other things you can do, tube feeding. Right? I adapted that again from the cattle industry. In the cattle industry, we don't wait for the mummy to give them colostrum. We just bolus them the colostrum and go about our business. Okay? Same thing with my kids and lambs. If they're not getting up quick, I just bolus them the colostrum, and then I know they're good to go. All right? And you can tube feed them. Right? With, again, other options is checking the level of your colostrum. Okay? And how good your colostrum is. I believe in a colostrum bank, okay? So when I have my good producing mummies, I always try and milk out some, I make sure the kid or the lamb gets first, and then I milk out the excess and keep a colostrum bank in my own freezer. Of course, date it, I use Ziploc bags. I just date when I collect it, and every 6 months I keep throwing out what I don't use. I have asked my neighbor who's a dairy farmer, he gives me colostrum too from the cows. So I always have a colostrum bank, okay? Again, if a mother is not producing, I can always bolus that colostrum. I know that baby is fine, and I go ahead, right? I have under 2% mortality with my lambs, okay? If you have CAE, we mentioned that, you can heat treat your colostrum, but also what you can do is probably get it from a cattle source if you need then, and use that instead, okay? And there are other options. This is a nice little milking machine out to the US. It's very pricey though, okay? But you can use things like that for bottle feeding, or you can use the buckets and stuff like that, So the other thing, like I said, why I dip my navels, septic navels, big problem. A lot of farmers lose their lambs or their kids. Now again, you wait 5 months, you feed the mother, wait 5 months to have this kid or lamb, and then you lose it. I think it's the worst thing that could happen. You wasted a lot of time and money. So please, dip your navels, and I do not know, or spray them. Why farmers fight you against it? It's so cheap and inexpensive, okay? And then when it gets septic like that, you're gonna have, like what you said, a swollen leg or kid with swollen joints. So what happens is that septic navel gets infected, it goes systemic, and then goes into the bloodstream and affects your joints, okay? And then again, that kid is normally gonna be dead. And even if it does resolve, the kid is normally not a very functional kid. Yeah, slow to grow, everything is wrong with it. All right? So to me, treatment versus prevention, I'm a big prevention person. It's always cheaper, right? Keep it simple, be consistent. Same thing with the FAMACHA, be consistent. It takes time and effort, but in the long run, it saves you money, you use less dewormers, your animals become better animals, right? Dipping neighbors, same thing. Vaccines, same thing. You have to be consistent. But in the long run, it will benefit you, okay? And save you dollars. And that's it.